If only they were big enough to take their health into their own hands. But sometimes danger is where you least expect it. That's why they have you to protect them. Lead poisoning is one of the most serious public health issues for children living in pre-1978 housing, and many are never tested. Exposure to lead can damage a young child's brain. Take their health into your hands. Learn the risks. Get kids tested. Call 216-263-5323 to find out if your child is at risk for lead poisoning.
Thanks for tuning in to TV20's Hot Topic. I'm your host, Leah Haslage, and today we're discussing lead poisoning, how it affects you, your family, and the community. Our guest today is Director of Public Health for the City of Cleveland, Toinette Parrilla, and Acting Director for Community Development, Michael Cosgrove. Welcome to Hot Topic.
Thank you.
So tell us about lead poisoning and what the main issue at hand is with it and how it's impacting our community.
Well, thank you for the question. Lead poisoning is a common and preventable environmental health threat. The Ohio Department of Health has identified since 2013 that there were 14,389 children with elevated lead levels in the city of Cleveland. The issue with having that many children with lead level increases is that it really affects them developmentally. Fortunately for us within the City of Cleveland, we do have a citywide preparedness plan on prevention interventions, and we work collaboratively with community development. They are our department that works very closely with health. I don't know if you'd like to add to that.
Yes, obviously a lot of the issue with the lead poisoning comes from our housing stock. So there are roughly 90,000 rental units, pre-1940 rental units, which means they've been treated with lead paint, and so obviously a lot of the problem we're seeing with the children is due to the age of our housing stock.
Yeah, I notice every time I sign my lease for the apartment, you have to sign a waiver that says if your house, the place was built before 1978. Why 78, and how is it affecting people living in the rental units in the homes of that time?
So 78 was chosen because it marks it's essentially sort of a safety point at which we can be certain that any structure built after 1978 that the paint in the structure was not lead paint. So essentially it's it's sort of a safety. Before 1978, there's always a concern that there may have been lead paint. Afterwards, it's using latex paint.
And now, does public health or community development have any involvement with making sure that apartments and homes no longer carry any kind of lead? Is there testing being done right now?
Yes, within the Department of Public Health, we do assess homes. There's a requirement that primary care physicians test all children at birth through the age of to 5 and thereafter if needed. We receive that information through communications with the Ohio Department of Health if they have elevated blood levels. From there, our case management begins and our inspectors are sent out to the homes to assess for the source, if you will. We identify if the lead source is coming from the windows, the trims, the paint, the dust, whatever we believe the assessed source may be. We inform the tenant and or landlord. From there, that child and or family receives a case manager to assist them with providing them with education and or if needed treatment.
Now, you're saying children being affected a lot. What are some of these symptoms that you're seeing that is kind of the red flag that this is a problem?
Well, the Department of Public Health has identified that this is an issue if they do have elevated levels in their blood. You may see developmental disabilities, behavioral issues, weight loss, fatigue, abdominal pain, seizures, loss of appetite, headaches, and at times a metallic taste in their mouth are some of the indicators that we see if they do have lead poisoning.
And how does it get treated? Is there a treatment for lead poisoning?
Yes, there is a treatment. If the blood level is greater than 45 micrograms per deciliter, the child must go through a chelation process, and that's done while they're in the hospital, which binds the lead and it's excreted through their urine. And that's really important so that they're not, they do not maintain that level of risk.
And then what's important on our side, on the community development side, is that we have funding that we then use to address the lead paint hazards in the house, so that when that child returns to the house, it becomes a lead-safe house. So we've been using, for the last couple of years, our community development block grant funds, and really what we've been able to treat is sort of the worst of the worst. And I'm happy to say that we did receive a grant allocation from HUD, announced about a week ago, $3.3 million for lead hazard demonstration grant that'll really allow us to expand the reach of our program. So we're talking about, we'll be able to treat 220 units over a 3-year period, so that when that child is treated and then released back to the home, they'll continue to be safe and no longer have the elevated blood levels.
Now, us receiving this grant is huge, because isn't it the first time in a few years we've been eligible? Now, tell us about that whole process of why are these grants so important to our viewers at home?
So, I mean, the grants are important because really, I mean, just by way of the scope, we treat maybe in the absence of this grant, maybe about 10 to 20 houses a year. So over a 3-year period, you're talking 60. And so because of that, we have to have such a high standard for the condition of the child as far as their elevated blood level, that we really have to limit and prioritize the cases where we treat the house. What the lead grant will allow us to do is, again, 220 units over a 3-year period. So you're talking just over 70 units. And then there's also a second component, $325,000 for what's called healthy homes. And so this is looking for things like asthma triggers, looking for infestations and things like that just improve the overall health of the house for the family that's living in it. So we'll be able to treat, over that 3-year period, 80 of those 220 houses will have those sort of treatments.
And where this ties into the Department of Public Health is that we will actually be communicating with community development and identifying the homes most at risk. We've identified, just through the data that we currently have, if you will, the hotspot locations. We will be providing that information for those individuals to submit their application for consideration, so that community development can abate the issue.
All right, when we return to Hot Topic, we're going to find out how you as the consumer can protect yourself and more about lead poisoning here in our community. Stay tuned.
Lead paint poisoning affects over 1 million children today. Just 3 granules of lead dust can harm your child. If your home was built before 1978, log on to leadfreekids.org.
Welcome back to TV20's Hot Topic. I'm your host, Leah Haslage, and today we're discussing lead poisoning. Now, what are we doing besides the grants to continuously address this lead poisoning issue? What are we doing moving forward?
I can say on the community development end, which again is more on the looking at the house itself, we actually have a number of programs that, while not directly addressing lead poisoning, address the lead hazards in the homes. So anytime our money goes into subsidizing rehabilitation of a house, there are certain lead-safe practices to make sure that the lead is properly encapsulated. So we've been using sort of our core funding, which we get from the federal government, to put in place, or to rehab houses, both vacant and occupied houses. So on our end, that's sort of a key piece that we do.
Any other key partners that are working within the city to help with this lead poisoning issue?
I know within the Cleveland Department of Public Health, we work very closely with the county. We work very closely with Environmental Health Watch. I know that this is really a big focus for community partners at large. It is a public health threat that we all need to make sure we're working towards to address. I'd like to make sure we make the distinction as far as community development is really focused on the structural components. Department of Public Health is really looking at the source of the lead poisoning for the child and really focused on doing the case management and ensuring that the tenant and landlord A, are aware, and B, that there's a remediation plan that follows.
Now, consumers watching this, if they want to protect themselves from this point forward, how can they do that? What should they be aware of and know what steps to take?
Well, they can either contact Community Development Department or they can contact the Public Health Department, and we absolutely are two departments that have great resources to assist them.
And I was going to say specifically, if they wanted to submit an application for the new program, it's looking like the grant year will start on October 1. We still have some back and forth with HUD on that. But if they do want to get a jump on submitting an application, the number to call would be 216-664-2045.
Any other additional information that you think our viewers should know in regards to lead poisoning or these grants that we just recently received or anything else with housing?
I think that it's very important to let the viewers know that it's very important for them to make sure their house is clean, make sure that their children are tested for lead, make sure that their paint is in good shape, and that they are ensuring that their children are not playing in soil that could be high in lead.
And what was the number again in case anyone wanted to get additional information?
That's 664-2045.
Wonderful. Well, thanks again for being on Hot Topic. I know I've learned a lot today. I'm sure our viewers have as well. So
Thank you.
Thank you.
And thank you for tuning in to TV20's Hot Topic. We'll see you next time.